Insulin is a hormone created and secreted by a group of pancreas cells that are called beta cells. This hormone is responsible to regulate the level of the glucose in the body. Whenever blood glucose level increases, like when you eat, the pancreas releases insulin into the bloodstream in order to lower blood glucose by allowing glucose to enter the body cells. When our body doesn't produce enough amount of insulin, means we have diabetes type 1. In this situation, people need insulin to survive. And about half of the people with diabetes type 2 need to use insulin at some point in their lives. In this video, we talk about types of insulin based on how quickly and how long they can control the blood glucose. Generally, insulins are classified into two main types. The first type is background or basal insulin that used to control the blood glucose level during the night and between the meals. They are taken 1 or 2 times each day. Basal insulins include intermediate, long-acting, and ultra-long-acting forms. The second type is mealtime insulin that helps control glucose after eating meals or snacks. They are given immediately before or after meals. The mealtime insulins include rapid-acting and short-acting insulins. Rapid-acting insulins affect blood glucose approximately 15 minutes after injection and last for about a couple of hours. They quickly absorb from fat tissue into the bloodstream and reduce the blood glucose. They're usually given at the start of a meal. Aspart, Lispro, and Glulazine are rapid-acting insulins. Short-acting insulins take effect about 30 minutes after injection and last for 3 to 6 hours. This type of insulin usually taken 30 to 60 minutes before a meal. A higher dose of short-acting insulins will have a faster onset and a longer duration of action. Intermediate-acting insulin generally starts its effect about 2 to 4 hours after injection and is effective for about 12 to 18 hours. NPH is the most common insulin in this category. Long-acting insulin reaches the bloodstream several hours after injection and can work for about 24 hours. This insulin is typically given once a day. Glargine and Detamir are long-acting insulins. The last type of insulin, known as ultra-long-acting, taken once every 36 hours or more. In case you forget to take it at its special time, take the missed dose at least 8 hours after your previous dose. Toujeo is the most common form in this class. Sometimes a mixture of different types of insulins combined in the same syringe. Not all insulins can be combined. The mixture of intermediate and rapid-acting or the mixture of rapid and short-acting insulins are most common mixtures. Never forget that all kinds of insulins should be prescribed and scheduled by the physician to prevent hypoglycemia or low blood glucose, because it can be serious and life-threatening in some cases.